everyone, and welcome to another exciting episode of Public Health Musings, your source for inspiring stories and discussions in public health. I'm your host, Dr. Caroline Kingori, and our focus today is on how AmeriCorps is addressing the nation's workforce crisis in public health. So before we start, this episode is brought to you by Okira Coffee, UKIIRA Coffee. Elevate your coffee experience today with premium freshly roasted beans delivered to your door. Use code SAVE10 for your first order. Treat yourself at shopokiracoffee.com. That's SHOPUKIIRACOFFEE.com. Our guest today, AJ Pearlman, is no stranger to the world of public health. She has a background that includes roles in the Biden-Harris presidential team, the Department of Health and Human Services, and now she's at AmeriCorps. AJ has a wealth of insight and experiences in public health, and she's eager to share that information with us. So let's give a warm welcome to AJ. Yay! We're so glad to have you on the show, AJ. So welcome. And, as we get started, I always want to find out, what's that story? What's your journey like? You've been with the Biden-Harris presidential transition team. You are now at AmeriCorps, and you've had all these amazing experiences in between. Could you share your journey and how these diverse experiences have shaped your approach to addressing public health?
Yeah, sure. So, it's kind of funny because lives and careers never take at least in my case, it has not taken a planned pathway, but it has made it all the more exciting nonetheless. So, my journey, it's such a winding road. And what I would say is that I have ended up here as the Director of Public Health AmeriCorps because it's a combination of all of my passions. I'm working in public health. I'm building the next generation of public health leaders, and I'm doing it through the federal government, which honestly, I never expected to have a career in the federal government, but it's been really exciting to be able to make change on the national level. So you asked me about my journey. I did not start out as a public health professional. I actually went to law school. And this just about back in 2010, after President Obama worked to pass the Affordable Care Act, I didn't know what this whole health insurance reform thing was going to be, but I knew that I wanted to get involved. And so I had an opportunity to join the Department of Health and Human Services to do outreach and education around this new law. It was, for me, I saw it as this great opportunity for millions of Americans to have access to health insurance. And, the interesting thing about it is that as I was talking to individuals and community organizations, healthcare providers about the new law, I noticed that there was no one talking to my community, the LGBTQ community at the time. So as we built out this stakeholder plan, I said, wait a second, can we include my community in this plan? And it really was an opportunity. I was lucky enough to be there. Folks said, yes, sure, absolutely. Are you going to do the work? I said yes. And through that experience, I learned the importance of showing up as yourself. I learned the importance of bringing your own lived experience to your role in your career. And I was able to actually change the path forward for the LGBTQ community when it came to health insurance, health policy at the time. So I, through that experience, really got a crash course in public health. I got to engage with individuals all across the Federal Department of Health and Human Services, as well as our community-based organizations who were talking with folks all across the country. And it was an opportunity for me to share how the new law could help the queer community. And it was that at that point in time when I realized the importance of being in the room and speaking up when decisions are being made. So fast forward now, over a decade, I have through that experience, had an opportunity to work in maternal and child health, to work on childhood obesity issues, to work in COVID and the COVID response, to work in healthcare and civil rights. It's been a range, but through all of it, it's really been about for me how I can have an impact and how I can help shape and better our country. And so that's been a bit of my journey. I would say maybe if I can highlight a couple of moments and things that have been really exciting to me. As Director of Public Health AmeriCorps, I get to actually visit programs all across the country that are supporting our Public Health AmeriCorps members. And it's through meeting these AmeriCorps members, some of whom are very early in their career, others who are, maybe embarking on a second career or perhaps served as contact tracers during the pandemic and said, oh, wait, what is this public health thing? How can I get involved? And it's been talking with those members about their stories that really inspires and motivates me. I'll give you maybe just one example. We have a member, his name is Fareed Howard. He's serving at the Los Angeles County Department of Public Health. He's actually in his second year of serving with Public Health AmeriCorps. And he actually worked at a guitar factory before the pandemic. And when the pandemic hit, he was laid off. And Fareed learned about Public Health AmeriCorps, said, oh, this is interesting. Let me explore this. And he's had an opportunity to do things like first aid and COVID education with unhoused individuals in Los Angeles. He's done COVID education, and he's actually now pursuing a bachelor's degree in health communications because he realized the importance of the role that he could play as an individual in his community's public health. So it's stories like those that are really exciting to me. And then maybe the last thing I'll say is I did have the opportunity several years ago now to work for Mrs. Obama when she was First Lady on her Let's Move childhood obesity initiative. And I did policy-related work, I did coalition building, but the important thing that I learned from Mrs. Obama herself was the power of trusted messengers. And seeing Mrs. Obama speak about the importance of healthy nutrition and physical activity for all kids has inspired me to consider how I can be a voice for public health and for our children and our future. So those are some of the things that have driven me to where I am now.
Oh, wow. What a fantastic story. And what motivates me the most and reminds me that I'm on a great journey in public health is how all of us just happened to bump into this public health door. We fell into it. Many people don't understand. Well, they kind of did after COVID or during COVID, but people are like, what is public health again? And I'm always like, it's everything you do. It's the food, the water, you exercising and taking care of your health. So from your stories, it gives pause to the fact that this is a field like anybody else, anyone. You started in law, I was interested in psychology, etc. And I like that part. And something else I wanted to ask you as a follow-up, we started with your journey, but I know there are people who probably don't know AmeriCorps and what it is. And I wanted you to just briefly describe that and what it's about, what it started, and how you got into this public health journey. But mostly, what is AmeriCorps?
Absolutely. So AmeriCorps is the federal agency for service and volunteerism. We work with organizations all across the country to provide opportunities for individuals to learn and to serve. So Public Health AmeriCorps is one of AmeriCorps' programs, and I can tell you a little bit about Public Health AmeriCorps, which is this really innovative partnership with the CDC. You mentioned we've all just lived through public health. Public health in action, I should say, because of the pandemic. And, if you had said 5 years ago to someone, what is public health? I think folks would have said, I don't know, or maybe it would have had trouble explaining. But given what we've all just experienced, many more people understand the value of public health. And through Public Health AmeriCorps, we're trying to capture and build upon some of that new knowledge that has come out of experiencing the pandemic. So Public Health AmeriCorps has a few goals. First of all, we're just looking to advance more equitable health outcomes in communities. We do that by providing people power in the form of AmeriCorps members who can help increase capacity in local public health settings, whether that's a public health department, a community-based organization, a rural health clinic, sort of a range of settings. At the same time, we're working to create pathways to high-quality public health jobs for people with diverse backgrounds and lived experiences. And we do that, I mentioned people power. The individuals that we engage as Public Health AmeriCorps members really get that on the ground experience and training in a public health setting. And the cool thing about Public Health AmeriCorps is you don't need to have any prior experience in public health. You don't need to have any higher education in public health. You just need to be, like I said about AmeriCorps, willing to learn and willing to serve. Maybe the last thing I'll say, given your focus, is that we hope that Public Health AmeriCorps is one solution among a number to help rebuild our public health workforce, given the shortages that we're facing and given the challenges that we're facing. Importantly, though, we want to do so with greater representation across the country from communities that are being served by our public health system. So that's what's really important to us. And we know these gaps and this shortage didn't happen because of COVID. It didn't happen overnight, but given the retirements that we're seeing, the burnout, we feel that there's a role for Public Health AmeriCorps members in a future public health workforce. And maybe I'll say what we have seen is that our Public Health AmeriCorps members are younger, they're more diverse, and they are earlier on in their career journeys than the existing public health workforce. So we think we're making a little bit of progress when it comes to building that next generation of public health leaders.
Amazing stuff. I want to come and work for you guys.
Well, we would love that. No,
my boss would be like, no, it's exciting.
If it's not obvious, I'm incredibly passionate about this work, so I could talk for hours about it. And I'm so committed to supporting our Public Health AmeriCorps members and to supporting our grantee organizations who do this work day in and day out. And I feel it's my role to lift up their stories,
right.
Because I don't think that folks in public health across the board get enough attention, given how much all of our communities need these efforts.
Right. And we have students too at our university who, are always interested in working with AmeriCorps. And I've seen the great work you guys are doing, and it's a lot. And so to continue with the conversation, you're very interested in addressing these pressing national challenges. You've talked about workforce crisis. So how does AmeriCorps contribute to addressing this crisis in workforce, and what kind of programs and opportunities does it offer in trying to make a difference in the field and in public health?
Yeah, so the PH Wins survey from 2021 said that we need 80,000 public health workers across the country if we're going to be able to provide core public health services to all of our communities. There's also the layer of which public health crisis is going to hit us next, and how are we preparing ourselves for whatever that may be. In addition to the existing COVID epidemic, right? We have the opioid epidemic. We have incredible health disparities in communities of color. There are existing public health crises that we are facing, and then there may be more in the future. So we have already put out about $160 million in funding. We're supporting more than 100 organizations all across the country who are placing members in public health settings, as I've said, in almost every state and in Guam and Puerto Rico. So just to give you a sense of the scope of the program, we have more than 3,000 Public Health AmeriCorps members who are serving. They're doing a range of different activities. Some folks are still engaged in COVID-related work, so vaccine outreach and education, supporting testing, community outreach, et cetera. Others are working on HIV and STI testing, or nutrition and food insecurity, or psychological first aid. We have some folks who are doing capacity building in local health departments to support health departments in better responding to the needs of survivors of domestic and sexual violence. So I don't need to tell you this, but the field of public health is so broad, and there are so many different opportunities for folks to serve. And it is in this service, this year of service, that individuals are actually getting that on the ground experience and experiencing what it's like to have a public health career. In addition, we also provide training. All of our members take foundational public health training that has been developed by the CDC. And we have other professional development opportunities throughout the year. For example, we do a monthly public health leader speaker series. We've had opportunities for members to join us at big professional public health conferences. We just took 30 members to the American Public Health Association conference, and other opportunities like that, so that folks are really understanding and feeling what it's like to work in public health. And then as members complete their year of service, they also receive an education award that they can use either to repay student loans that they may already have, or to use towards future tuition if they want to continue their educational journeys. So that's a little bit about Public Health AmeriCorps. Maybe the one other thing, if I could highlight, is just that the partnership with CDC is incredibly valuable and incredibly important. You asked about the public health workforce challenges. These challenges did not form overnight. CDC has been focused on the public health workforce for a long time. And what we're aiming to do is use AmeriCorps' focus on community and focus on service to sort of bring a new solution to addressing the public health workforce shortage. And it really is by leveraging the expertise of AmeriCorps along with the expertise of CDC as our nation's leading public health agency, and figuring out, like, can we do more together? That's what we're working on.
I like that. And as you were talking, I was thinking about how we can't graduate enough people in public health to join the workforce, or people in medical professions or any health-related field. And I like the fact that AmeriCorps says, come as you are, we are going to train you. And I think that's the game changer. Because often people are concerned, oh my God, how long do I have to go to school for? I don't have time for that. So in what capacity can they help in meeting this workforce crisis? Do they need to come full-time? Do they need to participate part-time? How can they be part of that effort?
Sure. So I mentioned we have members that are serving all across the country. recruitment and enrollment in the program is ongoing, so there are always opportunities. Let me just put a plug in for AmeriCorps.gov slash public health. You can actually go there and search by state to see what programs are working in your state and figure out whether there are opportunities for you. We have members that are serving in both full-time and part-time capacities. It's about half and half, actually. And that's due in part to the flexibility that we wanted to give our programs. Some public health challenges require full-time focus. Others may require part-time. And then also, we know that our members have lives. So maybe someone has family obligations, maybe someone has another job, maybe someone has, they're going to school as well, so they need a part-time role. So we do try to be flexible. We are trying to reduce barriers to accessing the program and also to starting on that public health career pathway. So that's pretty exciting. And there are also, as I mentioned, multiple different topic areas that folks can choose on which to serve. So I can provide a couple of examples. The American Heart Association is placing members in a number of states who are actually working on chronic disease prevention and are teaching individuals in rural communities how to take their blood pressure. So really thinking about how do we address chronic disease before it hits, and what are the ways in which we can engage folks, especially in those underserved communities. I mentioned that we have some folks working on nutrition security. We have a grantee called Food Corps that actually places members in schools that are working with children to teach them about healthy nutrition and doing sort of garden education and that sort of thing. And then maybe the last thing I'll say is we have programs that are also doing really innovative things through Public Health AmeriCorps. In Colorado, through the Trailhead Institute, we have a program called Colorado Public Health Works, which has worked with the Department of Labor to simultaneously have all of their Public Health AmeriCorps members go through a registered apprenticeship program to become registered community health workers at the completion of their service. So again, many different ways to serve and many different opportunities depending on where you're from, what you're interested in, and what you may bring to the table.
So speaking of children, right? We will segue to that. Your background includes work on addressing disparities in play, access for kids and communities of color. So give us some stories. And I like that you and I like, talking about, giving stories and bringing life to these experiences. So share some stories or innovative approaches you've witnessed or been a part of and have helped bridge those gaps, especially in those underprivileged areas.
Yeah. First of all, thank you for the question. I love talking about this. So one of the things that I have learned throughout my time in many different positions, but working in public health, is the importance of partnerships and collaboration. So I have had the opportunity to work from the nonprofit perspective. I worked with a nonprofit organization who has a long history actually working with AmeriCorps, but also building playgrounds in underserved communities. The organization was actually started here in Washington, D.C. after the founder read a Washington Post article about two siblings who crawled into a hot car because there was no place to play in their neighborhood. And unfortunately, they ended up passing away. And this was in the mid 90s. And the Washington Post found that there was no safe place for these kids to play within 3 miles of where they lived. So what getting back to me, what the organization was doing was building one playground at a time. And I joined the organization because there was a real interest in thinking about how can we do this at scale? How can we work together in partnership and in collaboration to address place, space, and equity on a larger scale? And through that role, I actually had the opportunity to work with local municipal partners, again, the government nonprofit tie, to build relationships and to form partnerships where we could, create play spaces for folks at the broader level. And just one example of this that I like to talk about is the organization was called Kaboom. We formed a partnership with Baltimore City Public Schools. And through that effort, we were able to do a play space assessment across the entire Baltimore City school system, and then work to figure out which schools were most in need of a new playground and tackle the issue of play space inequity from that perspective. So just all to say, I want to get back to that, the importance of partnerships. What was key to the work that I did at Kaboom was for each playground that was built in Baltimore, there was a community engagement process. Not only was it the school system, the city, our nonprofit organization, but also the input of parents, community members, and importantly, the kids into what that play space would look like, and leading to something that was owned by and supported by the community as a whole. So all I want to say from that perspective is just that we all have expertise to bring to the table. It's through our shared experiences and really by lifting up our own unique perspectives that we're able to solve problems together. And I think that combination and that collaboration is really important for addressing big issues.
And I'm glad you brought up partnerships. And I think that is what makes public health special. We understand that no one can be successful on their own. We understand that there is no health initiative that would work without collaboration, especially with the communities that are affected, right? And the need to listen and to, even though CDC says these are the statistics, we still go back to the communities and understand what their needs are, right? Their priorities. It's not always easy. It's not always time sensitive, but it's the only way to sustain these initiatives that come up. So speaking of partnerships, I wanted to talk more about those collaborations that AmeriCorps has. So can you shed light on the collaborative efforts and partnerships that AmeriCorps engages in to address public health challenges, and how these partnerships have sort of contributed to the nation's workforce resilience? Big question there.
Yeah, it really is. So first of all, to your point, CDC does have a role as our public health agency. CDC gathers the data. CDC has the expertise. That is incredibly important to our public health systems. And as I said, what AmeriCorps brings to table is those community connections. I want to talk a little bit about the partnerships at the national level, but what I would say is what's even more important are those connections that are happening at the local level and at the hyperlocal level. So where Public Health AmeriCorps can help fill the workforce gap and advance equity in our workforce is really through this non-traditional pathway into public health. We talk with CDC about how Public Health AmeriCorps is the only workforce fellowship program that CDC has that does not require any higher education. So we are thrilled to partner with CDC and to support those efforts, and also view this, as a new pathway into addressing some of our challenges. I think the other thing I do want to highlight on the partnerships front is just that we work very closely with national public health organizations like the American Public Health Association, ASTO, NACCHO, the CDC Foundation, National Network of Public Health Institutes, all of the big name folks who are doing work in communities as well, right? And who represent state and local health departments, et cetera. And for us, it's really sort of talking with those groups about how they can think about doing the public health workforce differently. So where are their challenges? I'll give you one example. We know that there are folks who are graduating with public health degrees or who want to pursue a public health career that cannot get through the hiring process in health departments. What are our opportunities to consider and to talk with our partners about how we can do things differently, right? How do we look at our hiring processes? How do we look at our requirements? Does this entry-level job really with entry-level pay really require a master's degree and 2 years of experience? Why? And let's peel back the layers of the onion a little bit. Also, where does the person find that 2 years of experience if there's no job that's available that doesn't have the 2 years of experience? So sort of thinking through some of those things. I would also say our national public health organizations have incredible expertise, incredible leadership that we allow us to share with our public health AmeriCorps members what the opportunities are, what the possibilities are for serving in a career in public health. And so we try to make those connections and use that as an opportunity for mentorship, to demonstrate leadership, and to make sure that our public health AmeriCorps members have the support they need for a positive member experience during their year of service.
Great feedback, because that's always the question. We have all the students, we graduate, like at Ohio University, we have an undergrad program, grad program, and all the entry-level jobs that require some experience, they don't want to count the internship experience. Doesn't make sense.
Right.
Workforce needs. How do we make this easy? And I'm so glad you brought that up, and I'm wondering at the national level, have they taken that on? And now are they peeling that back and saying, we are going to make this possible? Because we really do have a shortage of healthcare workers.
The conversation is happening, the conversation is always the first step. So the fact that that conversation is happening is a great first step in the process. The other thing that Public Health AmeriCorps is doing is it's giving our members an opportunity through their year of service to demonstrate the skills that they bring and the skills that they're learning. It's also giving them the opportunity to make those direct individual connections with folks who may be doing the hiring at the public health department. So every health department is different. Every organization looks different. The hiring processes are different, but oftentimes if you have that personal connection and someone has experienced the energy and the creativity and the skills that you have brought to your Public Health AmeriCorps service, the question is, can we figure out a way to keep this person on? So I think that's a piece of the puzzle. It's sort of one by one, but we're hoping that we're starting to shift the narrative there.
Fantastic. So speaking of the health department, you did work for the Department of Health and Human Services. And I think what I didn't ask in terms of your trajectory right now with your AmeriCorps job and when you were there, was this around the COVID-19 time? But when you were chief of staff and dealing with COVID-19, what was that experience like in terms of responding? And what is your perspective on the role of having a robust public health workforce?
So this is a great question. I get asked a question similar to this often. And I would say when I had the opportunity to work at the Department of Health and Human Services on the federal COVID-19 response team, we were working 24/7 to get vaccines out the door, to make sure that testing sites were set up, to make sure that folks were educated about the vaccines available, right? To make sure there were trusted messengers in communities that were talking about the importance of public health. And so what I would say is I was working up here at this national level. And what I saw and learned, and what prompted me to be interested in Public Health AmeriCorps, was just that what happens at the federal level is one thing, but it also is really important, and the work happens at the community level. It happens in states, it happens in cities, it happens in counties, and sometimes it happens oftentimes it happens in neighborhoods, right? So to me, I have functioned in this national world much of the time, but it really reminded me, and I would say through COVID specifically, what I saw very clearly was the impact on our public health workforce. Gosh, there are so many public health, like servant leaders who have been burnt out, who have been experiencing harassment through the course of the pandemic, and really they were doing the best that they could in terms of trying to take care of all of us in a very difficult and shifting scientific situation and atmosphere. So to me, I really learned about the importance of what the public health workforce was doing. I would also say I learned that there is a role for everyone to play in public health. And we saw that on the AmeriCorps side as well. Even before Public Health AmeriCorps got up and running, we had AmeriCorps members who were maybe serving in an education program or serving in the climate program. When the pandemic hit, everyone jumped in. They were doing wellness checks on neighbors. They were dropping off food. They were, helping folks get to appointments. They were staffing testing sites, right? There was a role for everyone to play. And that has really shifted for me how I think about the public health workforce. We absolutely need epidemiologists. We absolutely need data scientists, right? We also need food inspectors, and we need community health workers, and we need a whole range of individuals. So there's a role for everyone to play.
Fantastic. So that brings us to our last question. As you've put out that call, there's a role for everyone to play. So those of us, who are passionate, my listeners, people who'll be watching this, and they want to get into public health, or they want to enhance their public health experience and want to make a difference, what advice would you give them regarding opportunities to join AmeriCorps or similar programs and contribute to those nations' public health efforts?
First of all, if you're looking for a career in public health AmeriCorps is a great place to start. You can really, I've heard members say, I just wanted to get a taste. What was it like? So you can visit AmeriCorps.gov/public health, as I said, just to see what opportunities might be available in your state. There are part-time and full-time roles all across the country. And, I would really encourage you to stick with it, sort of learn and experience what it's like to work in public health and figure out the pathway that is right for you. I would also say I imagine you've got a range of individuals who are listening to this podcast. For those who are hiring in public health, think about hiring individuals with non-traditional experience. Think about how you can reframe your job postings to include lived experience, to maybe include national service experience. And the last thing I'll say is hire AmeriCorps alums into public health jobs. The one thing about AmeriCorps is it gives you the chance to work across lines of difference, to work on highly effective teams and really in diverse communities. So AmeriCorps alums bring not only the experience that's on their resume, but also just the experience of supporting communities all across the country. So that if I can give that advice to those who are hiring. And maybe the last thing I'll say, if I can, is I have, as I said, had a little bit of a winding career pathway, both in public health and sort of adjacent. And I have found that I've jumped on opportunities and I've used my voice. And I feel like I have been able to make an impact because I've walked through that door. Maybe it was a little scary, maybe it was a lot scary, And I've spoken up where I thought it was important for communities, and I would encourage those who are listening to do that as well.
Thank you so much, AJ Pearlman, for sharing your valuable insights and experiences today. This was so exciting. I learned a lot. It's been truly inspiring to hear about AmeriCorps. I knew some stuff about you and your organization, but just seeing the passion that you have, again, really solidifies me being in this field, and I want everybody else to experience that as well, in addressing these issues that we have in public health. So thank you so much. And to our listeners, remember that change always starts with awareness and action. And today you heard a little bit about AmeriCorps and how you can get involved in public health and help alleviate this workforce issue. And so if you are a seasoned public health professional or just someone eager to make a difference, your involvement and commitment matters. So let's be change makers. Let's be advocates and champions for public health and inspire each other to create healthy communities for everyone. Thank you for joining us on Public Health Musings. Stay tuned for more empowering episodes. And until next time, keep those musings on public health alive. So thank you, AJ. And so glad I will be calling on you again. So I'll follow your work and just touch base and see how everything is going.
Well, thanks so much for having me. This was fun. I hope you got what you needed. And as you can tell, I'm passionate about all of this work. So let's keep it up. And I would love to stay in touch with you and see if there's anything else we can do together.
Fantastic. We are going to ignite this fire.
I love that.
And help it, spread that good fire of making change and working together with our communities. So I'm really excited about that. So until next time.